I'm here with Dr. Johnson here at the Sports Center at the South Central Health Center. My bad. And we just have some questions for you. So you ready? All right, cool. First question is, how do you get your clients relaxed enough for you to work on their injury?
Well, relaxation is very important, and what I do is I just have them, prepare for treatment. I do a little massage work on their back. As a chiropractor, I deal mostly with the spine and the neck, and so doing adjustments and cracking their bones sometimes is a scary thing for a patient. So I just try to get them to relax. It works better when they are relaxed. So a little bit of massage work, a little muscle work, and so forth helps a lot.
Alright, that's good. The next question is, if a 20-year-old and a 40-year-old have been exercising and dieting all through their life and haven't suffered any injury, is there a different time span in their recovery? And if so, how?
Well, if a 20-year-old and a 40-year-old suffer the same type of injury, there's definitely going to be an improved recovery period for the younger person. Young people always recover faster. It's because their body is, the metabolism is faster, they're more active. Usually young people are in sports, they're out, they're active and things. And us old folks, we just sit at home and watch TV most of the time. So yes, a 40-year-old and a 20-year-old would definitely have the 20-year-old would have a faster recovery rate, usually.
Would you know, would you be able to estimate, if they would recover maybe a month or two faster, or a
faster?
couple weeks? Yeah. You wouldn't be able to say.
That depends on the body, the person, yeah. A lot of times, now we deal with children too sometimes, 10, 11, 12 years old. They've been in a car accident with their family and they come in here for treatment. And we usually don't treat them more than 10, 12 visits or 12 treatments, whereas opposed to a 40-year-old parent, a mom or dad, they might be coming here for 2 or 3 months.
Alright. The third question is, if I broke my foot, or not broke my foot, if I had an injury, can you tell me exactly what you would do for a recovery process?
For recovery? Well, if it was a broken bone,
Yeah.
First of all, as a chiropractor, I wouldn't be doing anything with that. I would have to send them to the hospital to be set. The bone would have to be set and possibly put into a cast or a brace or something to immobilize it. But after the healing has gone by and the bone is healed, they still have some residual muscle pain and ligament pain and tendon, and so I can help with that with some of the equipment that we have to ease their pain level.
All right.
As they begin walking on their ankle or using their hand again.
Can you tell me how important it is to have a good nutrition when recovering from a broken bone or a torn muscle?
I think everybody knows that diet and nutrition is very important. We need to always, watch what we're eating, especially in times of injury, because the body heals itself and it has to use the bloodstream. It has to use, in order to heal ligaments and tendons and muscles, it has to use good nutrition and be able to, have that immune system built up too for the recovery process.
All right, so the next question is, did you have extrinsic or intrinsic reasons for becoming a chiropractor? So for extrinsic, did you take this job because the money is good and you like the name of being a doctor, or was it intrinsic? Did you have a certain passion to do what you do, and does the money come second, or is it a little bit of both?
Yes, yes, and yes. I was a patient first. Back in the 80s, I had some pain in my arm. I couldn't explain how I got it. It was just irritating me. Several doctors couldn't help me. They gave me medicine, and it just didn't go away. It was an achy feeling and a weakness in my arm. Somebody said, go to a chiropractor. I had a friend from high school that I went to. He told me what chiropractic was, and he, over the course of about 3 weeks, he was able to adjust my neck, which was pinching on the nerves that come into my arm. And so when he released the pinching in my neck of that nerve, then the pain went away. I regained my strength. So I thought, this is amazing, and I wanted to learn more about it. I also wanted to help other people with it, and I also could see through his office and through his, seeing him, I could tell that he was making very good money. So I thought that was attractive too.
That's good. That's cool. All right, so how much do walk-in sessions cost?
That sort of depends on what I do. For example, if somebody comes in and they have a minor neck pain or a low back pain, which is predominantly what people suffer with, they come in and they fill out the paperwork, and I go through a little exam and find out, how did it start and when did it start, and I also find out, exactly what their pain is, and that's the exam. I charge for that, and then there's a charge if I take x-rays. There's an additional charge, and then the treatment. And depending on if I do 1 or 2 treatments, or what we call modalities, then the charge would be based on that. But normally, a regular chiropractic adjustment in the neck, the low back, and so forth is about $45 to $65. X-rays would be probably $75 to $100. So it can get up to the first visit being maybe $200 or more. But normally a standard adjustment and some therapy, we charge usually about $60.
All right. Are there ways that you work on different people with the same injury, or do you have the exact same procedure or routine for the same?
It wouldn't be a lot different. If there was the same injury, if you had a sprained shoulder, and somebody else had a sprained shoulder, or if you had a low back ache, and somebody else had the same thing, usually it would be about the same type of treatment. The only time it would vary is if one seemed to be a little more severe, less recovering, in other words, not feeling better at the same rate of speed and so forth. Then I might look around to change the type of therapy that I do.
All right. Have you had any interns come in and want to learn from you, or have you, before you became a chiropractor, have you gone in and tried to learn a little more from other chiropractors?
I did. I was in chiropractic college, and I was in my last year and getting ready to go out into the workforce. And I wanted to learn more from chiropractors that were already doing it. So a lot of my mentors and even my teachers at chiropractic college, they had private practices. So I would go to their office, sometimes at night, and they would take time to show me different adjustment techniques and so forth. I wouldn't really see their patients, but they would explain things, they would teach me things, and I would learn things from them on building myself up as a chiropractor.
That's cool. And okay, last 2 questions. The next one is what was the salary you received starting as a chiropractor, if you remember?
Well, when I graduated chiropractic college, it was 1995, and they said that 5 years out of chiropractic college, a chiropractor can expect to make anywhere between $80,000 and $100,000 a year. That was very appealing to me at that time. It was a lot of money, and I found quickly that because of managed care and insurance companies sometimes paying for some things that we did and maybe not paying, or a reduced scale, things like that, it's still a good profession and it's still lucrative. I make a good salary, but it's not something that I'm not making well over $100,000 like some are. Some chiropractors do make a lot of money. if they have their own practice and they have built up a base and so forth. I'm working at the clinic here. I'm an employee here. It's not my clinic, but I do make a good salary, and I'm grateful to have the job.
All right, good. All right, so last question. Do you feel going into this field was the right choice, or do you feel you could have excelled in a different path?
I probably could have excelled in anything that I wanted to do, but I really, at that time, wanted to become a chiropractor. I wanted to be able to help other people like a chiropractor helped me. And I just felt like it was an awesome thing to have somebody with a headache get an adjustment and say, my headache's gone. And that's actually happened to me several times. It instantly goes away, and it makes me happy, and it definitely makes the patient happy. So I'm glad that I went into this field, and I really enjoyed it.
No regrets.
No regrets.
Awesome. All right, that concludes the interview. Thank you again.
You're welcome.
Letting me interview
Appreciate you
you.
coming by.
All right, thanks.